how to improve the progress from patient experience. So as we go, if there are any questions, feel free to put them in the chat, and we'll try to pause after each slide to review them. I may need Andrea's help to remind me to look at the chat, but I'm pretty excited to share what we have on this. All right. So just some discussion takeaways to kind of give us an idea of what we're going to chat about today. We're going to look at the fundamental education rights that are guaranteed to a child, the differences between an IEP versus 504, and how to request these plans from your child's school, how to educate your child's school staff on intestinal failure and other medical needs that they may have, and how to engage your medical team in participating in the matriculation process. I just want to say we want to keep in mind that every state is different and has very different terms used within their school district. They have varying guidelines and different versions of an IEP or 504 plan. Plus, every medical team is different, so engagement level in this process can vary. My knowledge and guidance is based on information and experiences from a lot of different states, but the language I use stems mostly from New England school districts. So I'll do my best to keep things as broad as possible and answer as many questions particular to your state as I can. All right, so the first thing we're going to chat about is knowing your rights. And full disclosure, I'm not a lawyer, but I always find it really helpful to review these to kind of ground us in what we're hoping to meet when it comes to these schools, and also as a key way to remind schools what our children are capable of and why they should have access to it, what laws we use to really set in stone their ability to go to school. So the first one is the Individuals with Disabilities Education Act, known as IDEA. This is an education law that requires public schools to meet unique needs of K through 12 students with disabilities. And schools do this by providing different services. Some of the services you may see are things that are often found in an IEP, which is something we're going to talk about. But services can look like physical therapy, occupational therapy, certain tutoring services like extra time with math or reading, stuff like that. Then we have the Section 504 of the Rehabilitation Act. And this is a civil rights law that prohibits disability discrimination at schools that receive federal funding. So what we talk about here when we say federal funding is we're primarily speaking of public school districts as well as some charter schools. Private schools do not receive federal funding. And for a 504, the school meets these requirements by removing barriers to learning. And typically when we think of a 504, we think of specific accommodations, which we're going to highlight, and I have some concrete examples of what you can ask for later on in the presentation. And then we, of course, have the Americans with Disabilities Act. And this is a civil rights law that prohibits disability discrimination by schools, employers, and anyone who offers goods and services to the public. So what does this all mean? This means your child has the right to a free education alongside their peers in the least restrictive setting. And again, a caveat I do want to say is sometimes schools that aren't federally funding have their own guidelines and rules. And so that's something that you want to keep in mind when you're requesting certain services and also picking the school you'd like your child to go to. Okay, so who should be involved in the matriculation process? Well, obviously the school district needs to be involved, as well as the specific school your child is attending. It's also important to involve the special education team because they're the ones that will help support either an IEP plan or a 504 plan. Your nursing team at school is very important because they're the ones that are going to be providing any of the medical cares that you typically provide during a day your child's not at school. And of course, you and your child are important. A representative from your child's from your child's medical team can also be involved in the process, as they can join you in speaking about your child's specific medical needs during the school day. But obviously, again, this depends on the resources that your team has and the level of involvement that they're able to participate in. But I have found that when there is an ability to pair with your medical team, it does end up being really beneficial. And I'm going to go into ways that it can be beneficial. So if your medical team agrees to engage in your child's school matriculation process, they can offer support in a lot of different ways. The first one is composing individualized school orders. You can think of school orders as kind of like a care instruction list. They include timing of medications if they're needed during the school day, enteral nutrition schedules, timing of PN or fluids, how to react during urgent needs or emergencies during the school day. So it's basically an organized list of instructions of what you would typically do for your child's care during the day if they weren't in school. And the goal here is to ensure safety and also balancing the ability for the child to actually go to school. So having your team create school orders is really helpful because it acts as a guide for the school nursing staff. I know in some states, they have additional forms that need to be created. They usually have one for G-tubes in particular, I found. And these school orders can be in addition to the forms that the state requires or the school district requires. So your medical team can also further explain the child's medical condition and the devices that they use. Depending on your child's medical condition, it may not be as common. And so school nurses, they have an incredible education, but they may not see your child's condition every single day. And so, of course, you are the expert of your child, but having the medical team chime in about, their understanding of the condition and what it is to take care of them can be really beneficial to solidify to the school that this is something that you need to take seriously. The medical team can offer a review of medical interventions your child may require during the school day, like a dressing change or CVL care. One thing that my team in particular has started participating in is offering Zoom sessions with school staff so that they can provide a review of how to do a CVL care or what to do if a G-tube pops out preemptively before the school year starts. So then, they can freshen up on any skills that they may not use day to day. The medical team can clarify a child's ability to participate in sports, activities, and water activities. And they may even be able to provide triage support during the school day. Now, going back to that first bullet of composing individualized school orders, a part of that is kind of like a contact tree of who should be notified in the event of an emergency. And a lot of the times we want the parents to be first, but if there is situations where, oh, I heard, Johnny had a medical appointment the other day, did his G-tube plan change, or did his enteral feeds change? Can you write an updated order for that? Those are some things that the medical team may be able to help triage during the day instead of having to go through the parent and then the parent go through the team and then circle back. Any questions about how a medical team can be involved?
Nothing in the chat yet.
Awesome. Okay, great. Okay, so going into detail more about the school orders, again, orders are created by you and your medical team to outline the medical care your child may receive during the day and during an intervention or during an emergency. And you can get really particular when it comes to school orders. You can give the details of how many mLs of an enteral feed through the G-tube, what's going on with the CBL, what do we do if the dressing is looking kind of wonky, do we change it or do we call the parents? What about ostomy cares? Do you want us to record the ins and outs? What do you want that to look like? This is your opportunity, school orders is your opportunity to really get into the nitty-gritty details, because at the end of the day, it is signed by a provider and reviewed by you as the caregiver. And so the school can use it as, like I said, a guidebook on how to take care of your child in the safest way during the school day. It can include emergency interventions like clamping a CVL, replacing the G-tube, reinforcing a dressing. And it can also include the emergency medical plan, like when to notify a caregiver, requesting support from the medical team, and or calling an ambulance. Now we're going to dive into an IEP versus 504. And again, I just want to throw my caveat out there. Please review your state's guidelines, because IEPs and 504 coordination processes are very different based on the state, based on the school district, and based on the type of school. So what is an IEP? Stands for an individualized education program, and an IEP is to legally state a child's special education instruction, supports, and services they need to thrive during the school day. They're used in public schools from pre-K through grade 12, and typically only recognized by public schools, also charter schools, because again, we're talking about that federal funding. The process begins with an evaluation that shows a student's strengths and challenges. Families and schools use the results to create a program to meet the student's needs, and medical conditions can be included in a child's IEP. So the main point of an IEP is to highlight the more educational needs the child needs, even though you can acknowledge the fact that the child does have a medical condition in an IEP. And the medical condition can be why they need an IEP, but the services that stem out of an IEP are more concrete and specifically towards your child's education, as well as the services that they need that they may not get in the community. So for instance, we're talking about, extra time to receive tutoring support for reading, math, social studies, whatever they need and support in, maybe extra time on a test. This also includes physical therapy, occupational therapy, speech and language therapy. And one thing that I have noticed in some states, I don't know if it's everywhere, but when a toddler is in early intervention, which is typically age 1 to age 3, before they age out, I've noticed that some parents actually advocate for the early intervention team to support the transition into some type of program, some type of school program, whether that's daycare or I think pre-K starts around 4, so maybe not pre-K quite yet. But in doing so, you're able to actually start essentially the IEP process, because any type of services early intervention feels your child should continue to have will be accessed through the school. It's a common pathway to ensure that they're getting the services that they need in the community. And so I found that you do have to advocate in some instances pretty hard for the early intervention team to formally make these requests and start that process. But in doing so, you actually created a pathway for your child to start school, and it can be really beneficial and make things a lot easier for you in the future. Because the sooner you ask for these services, the harder they are to take away. I'm going to go into detail more about the IEP, but I see that there's a question in the chat. Says, do you offer a general form for medical team to fill out for school about the G-tube, or should families request from the school? That's a really great question. I think it depends on your state. Some schools offer, like I know New York and I think Florida recently sent us forms to specifically fill out. So your school may actually have one. The school district may actually have one that they want to have used, and you should ask for it. Other times, schools don't have them, and so we typically include any information on a school order. You could also have both. You could have a school order and the form completed. So it really just depends on your school district. That's a really great question. Okay, so I wanted to pull some examples of what an IEP can look like. Full disclosure, this stems from Massachusetts. We actually just had a whole update in the process, the format, the process, the everything about it has changed, and it's been upgraded. And so from my understanding, they're trying to make IEPs more universal across the country. I don't know where we're at in that process, but I thought sharing an example of what some of these IEPs can look like can be really helpful, because there's a lot of different points throughout the form where you can highlight your child's medical needs. So right from the beginning in the student profile, this is where you have the opportunity to list your child's disability right away. And you'll see I highlighted the health impairment. Obviously, there's other aspects of health impairment that they actually detail, like intellectual, neurological, physical. But when I think of health impairment, I think of these kiddos that are nutrition support users. They're the ones that go to school and maybe they don't look like they have anything wrong with them because they're running around, they're interacting, they're playing. But if they lift up their shirt and show off their tummy, they have a G tube, or they have a central line, or maybe they have an NG tube and you see it. So I always find that this category is actually really helpful because it causes the people who are reviewing the IEP to pause and think about what this child may need. The second section in the IEP that is interesting to me is the community and interagency connection section. I would communicate with your medical team if they're comfortable with this, but this could be a really great spot to put your specialized team's information in as a way to, again, make them pause and say, okay, do we need to contact this medical team about something? Was there a nursing order plan that we should be following? It's just another great spot to make them pause and think about the intricacies of your child's care. The second section, or a third section that is very unique, and I hope that this is in more IEPs, is a transportation services section. And this is really helpful because we have some patients who start the school day still hooked up to PN, or maybe they're getting enteral feeding, and they need to commute to school without a parent, and so there isn't a parent there to disconnect them from anything. And as a caregiver, it can be scary to send your child off connected onto a bus and being like, okay, hopefully nothing happens. Within this section of an IEP, it's an opportunity to say, my child needs to have specialized transportation, and within that, I'd like an attendant to join my child. That way, maybe they can't, triage the situation, but they can at least monitor your child and make sure that, there's nothing going on the bus. A lot can happen with children on the bus. But by having an attendant there to monitor the situation, it's an added layer of protection for your child and hopefully comfort for you in knowing that your child can be on the bus, but there's someone there to back them up if they need support, or there's someone there to call you if something looks like it's not going okay. I'm going to pause. I see another question in the chat. Maria asked, are schools obligated to develop an IHP, individual health plan? Would it be beneficial to give the school nurse authorization to contact the medical team directly? Great question. So they're not obligated to create an individual health plan. You need to ask for one. They may notice when, if you do a meet and greet with the school and you mention that your child has medical needs during the school day, they may say to you, okay, we need to create one. But if they aren't aware of your child's medical needs, then you definitely need to advocate for one and ask for one. And when it comes to your second question of giving the school nurse authorization to contact the medical team, I think that's very helpful. The goal of this entire process that we've been working on as a team is to really create a partnership between you as a caregiver, the student, and the school and the medical team. And if your medical team is able to contribute in the process, then having them in the partnership really helps for situations kind of like your question asks, is it beneficial to give the school nurse authorization to contact the medical team? Because by building that partnership, more supports are created for your child, hopefully more accommodations are created, and a greater understanding is given. So yes, I definitely recommend that, but I also recommend for you to be a part of that conversation, because your voice is just as important as the medical team's. And finally, another section I wanted to highlight in an IEP is the fact that you can reject it. You don't have to say yes to it. This is a legal document, and you don't have to say yes to it at the end of the day. You can go home, you can think about it, and you can actually reject certain parts of it and accept other parts of it. So even though in these intense IEP meetings, it can feel like it's a cut and dry situation where you need to make a decision on the spot and it needs to be yes or no, that's absolutely not the case. You can say yes to certain portions of it. You could say no to the other half. You could say no altogether. So just know that you have time to process it, and you can make them come back to the table and say, no, we need to figure something else out because this isn't going to do. So know that you have that right. I also want to acknowledge, though, that doing that is not always easy because these schools are federally funded. And so some of the supports that we hope we can receive kind of get cut in half because of funding or lack of resources. So none of these suggestions are meant to make you feel like it's an easy process. It's a very dynamic process, but there are certain tools and things to keep in mind to hopefully help you continue to advocate for your child's best needs. All right, switching gears, we're going to talk about the 504 plan. This is a formal plan that schools develop to provide children with disabilities the support that they need. It covers any condition that limits daily activities in a major way. And when we talk about a 504, we're basically talking about accommodations. For example, a child might receive extended time on tests or the ability to leave the classroom for more frequent bathroom breaks. The most significant difference between an IEP and a 504 is that there's no formal evaluation or testing needed for a 504. So with an IEP, your child goes through pretty significant evaluation because specific criteria needs to be met in order for the services to be received. But with the 504, that's not the case because we're talking about accommodations that help them get through the school day because of their medical condition. So instead, a comprehensive documentation is required. And 504 plans do not need to be updated annually, but we do find that parents and even schools like it to be updated because your child grows and changes, and so their accommodations often change. So I think this, another thing that really differentiates an IEP from a 504 is, again, IEP is more educational and service-based, 504 is more accommodation-based. I figured it could be helpful to review some 504 accommodation examples that we have used specifically on our team. Our team sees patients with intestinal failure, so we have a lot of kiddos who utilize PN through their CVL, G-tubes, some have NG tubes. We have a variety of kids with ostomies. So that's where a lot of these examples stem from, but they could probably be expanded into other medical conditions. So the number one that we always find very helpful to make sure the school has an understanding of is excused absences and tardies due to planned and unplanned admissions medical appointments, and symptom flare-ups. We all know we have days where your kiddos are just having a really tough morning because they don't feel good, they're nauseous, they're, they just maybe can't even explain what they're feeling. And so having a level of understanding from the school that these absences and tardies need to be excused is very helpful, because we know that schools can be very strict, and as they should, they want your student to get an education, but at the same time, we can't always predict when a flare-up is going to happen or when someone's going to be admitted. And so having excused absences straight out at the beginning of the year is always helpful. Along the lines, the ability to access the curriculum during extended absences. So if there is a planned or unplanned admission and you're anticipating that your child's going to miss a significant amount of days of school, it's important at the beginning of the year to say, okay, once we hit X number of days absent because of this admission, we want to make sure that the child has access to the curriculum. How can we do that? Are there options for homebound learning where they can learn, from bedside, or if they're feeling up to it? Some hospitals have access to child life services who can connect with tutoring. Can we have the school work with the tutor to make sure that they're able to catch up? And of course, all of this is dependent on whether the child even feels up to doing it, but it's nice to have this accommodation in place ahead of time, because then, when you need to use it, it's there. Access to a separate private bathroom due to the nature of gastrointestinal symptoms. Ability to provide the nurses with a change of clothes in the event there's accidents or stains. Ability for a caregiver to provide a central line care kit, G-tube supplies, emergency supplies to the school and stored in the nurse's office. I know the school always appreciates when parents bring in supplies. I know it can always feel like a pain because a lot of us are finding that these supply companies are not providing exactly what you need. But if there's an opportunity to leave the school with some type of supplies, that's always very helpful because then they can actually follow the school orders that are requested. Participation in activities that pose risk of blunt trauma to the abdomen, chest, or central line should be limited, and they should be offered an alternate activity. So obviously we want our kids to be able to participate in the fullest way possible, but sometimes there's activities that just aren't safe, and that's always a hard conversation to have with your kiddo. But when they're offered an alternate activity, there's an opportunity to still participate to some level and feel like they're included. And this next one's kind of dependent on everyone's feeling about water activities and central lines, but it can be helpful to notify a caregiver if a water activity is planned so the caregiver can plan ahead. So that could look like, if you and your medical team are not comfortable with the central line getting wet, then perhaps they're offered an alternate activity. If there's some level of water exposure that you're comfortable with, maybe there's an opportunity to put a smock on, a water smock, so that it's protected. Just communication to make sure that everyone feels safe. Another big one is unlimited access to hydration throughout the school day due to risk of dehydration. And then also extra time to eat their meal if they suffer from oral aversion. This accommodation has actually come up in the most recent years because we're finding that oral aversion is very significant in this community. And when they have this goal of trying to eat by mouth, or gradually increase their ability to eat by mouth if the medical team says it's safe, we'd hate for that goal to not be practiced in school because, one, they're in school for such a significant part of the day. It'd be a shame to miss out on the opportunity to practice that skill. But then two, it's an opportunity to participate in community activities like lunchtime, snack time. And so if your kiddo is given extra time to maybe nibble on that cracker a little longer so that they can gradually increase their tolerance, then we'd hate for them to miss out on that. Having this accommodation can help mitigate that. Any questions on the accommodations? Okay, so I want to wrap up by saying a few things to keep in mind. The goal of matriculation is a partnership. You want to build this partnership between you, your child's school, and your child's medical team, if they're able to participate, because your voice is incredibly important in advocating for your child. And as your child is able to start advocating for themselves, we want their voice heard. By building a partnership, we have found that your voices are amplified even more when the medical team is backing you up and explaining to the school, yes, this is something that needs to be taken seriously, because schools may not always understand what's going on. They may not understand your day-to-day and how much effort goes into keeping your child safe. And by having you all work together, we find that requests are met more willingly. Maybe it requires a harder conversation, but the requests are heard and a compromise is made to make the child, to allow the child to participate in the school day in their own way, but in a safe way. You are creating a pathway for your future access to accommodations, resources, and understanding. So again, the sooner you start this process, the more likely you are able to continue to request these things in the future. Going throughout the day without a one-on-one nurse or without a para in the first few years and then trying to ask for it later on could be really hard, because the school comes back and says, well, they didn't need it before, why do they need it now? And things, of course, change, but for some reason we see a disconnect. And so asking for things sooner is always better than trying to get them later. You're your child's best advocate. You know your child left, right, up, down, all the things. Keep that in mind. Don't let them think that you're not. Don't let them make you feel like you're not. You'll often be the educator of your child's diagnosis, and this can be exhausting. I've had many caregivers share to me, I'm so exhausted from having to explain what's going on, why my child needs this, why my child needs that. And it's true, it's exhausting, but just know that, again, you are your child's best advocate, and every time you repeat it is another time that they're hearing it. And lastly, you have the right to ask questions and the right to ask for accommodations and evaluations to be made for your child. All right. Thank you all so much for having me. I see another question has popped into the chat. What are your suggestions when the school states that your child does not qualify for an IEP, only 504, because there aren't any learning disabilities, only physical? That's a great question. That would be, if I'm understanding your question right, and I may not be, but that would be the point of a 504 rather than the IEP, unless you're trying to request services. Oftentimes, schools will say that you can receive some type of support outside of the school, so like in the broader community, for physical therapy, occupational therapy, feeding therapy. And I'm not sure if that's not an option in your community. I'm not sure if the resources, are there, but you can still request for the school to reconsider, especially if there's, concrete evidence that your child needs those type of services. If you're referring to more of the physical nature of your child's medical illness, like the requirement of, extra time in the bathroom or the ability to get up and run to the bathroom, those would be something that you find in a 504 versus an IEP. Hopefully that answered your question.
Thank you, Ashley. And I will give people time to think about their questions or type them in the Q&A. I just wanted to say that I love that you brought up that parents can think about the IEP and not just have to sign it right away, that they can come back with suggestions or feedback or pushback on things. Because I feel like a lot of us feel that we just have to do with what's given to us, but that's not the case. So thank you for bringing that up. And the Zoom lessons too, something I hadn't thought of is, what an easy way to get the team to be able to talk to the school without, it's impossible to have them there physically, but certainly Zoom is much easier now to have that communication.
Yeah,
And then one thing
absolutely.
that I remember hearing at the Oley conference, and I'm not sure if you said it or one of your colleagues, but it really struck with me is I think a lot of times clinicians, are looking at the child and thinking they're focusing on lab trends and weights and more of the nutritional thing. And so, just encouraging parents and your kiddos to think about what's important to them, and really advocating that, if the clinician's thinking, okay, we're going to take you off of nighttime feeds and put you during the day bolus, but maybe that makes them go to the bathroom more. And so they'd rather have it a different time, or going to prom or things like that. Is just kind of speaking up for what's important for you and your kid to your clinical team or whoever's managing your care. So
Yeah.
thank you.
Yeah, absolutely. Yeah. And I love that point. I remember, yes, we spoke about it in the body image section, and I should have put it in this because it's so true. You can ask your medical team, Johnny really wants to play a sport. How do we make that happen? Is it safe to do that? Are there certain devices that we can use to help protect their line or their G-tube or their ostomy bag so that they can participate? Can we move around PN hookups so they can stay at practice? Having your medical team involved really does grant you the ability to make changes so that your child's ability to access certain extracurricular activities can be made.
Yes, absolutely. Thank you so much, Ashley, sharing your time and expertise with us. Oh, we just had got some questions pop up.
Yeah. Okay, I see one that says, I feel I want a health pair for my son in school to ensure he's only eating the allowed foods in the allowed amounts, not having other kids share their snacks with him or having to go to the water fountain and take a cup of water for himself. Would that be under the IEP or 504? Is it something I need to pay privately for? That's a fantastic question. So a lot of those pieces that you mentioned would be within a 504, like making sure he is able to get water, he's able to access the fountain, making sure that we're avoiding snacks. So actually, this is so interesting that you say this. So your comment about not having other kids share their snacks with him. I actually had a parent last week bring this up to me, and we put it in his 504 because we wanted to make sure that, he wasn't partaking in any, eating that he wasn't allowed to. And so the mom came up with this fantastic idea, and understand that not everyone can do this, but she proactively provided the teacher with a bag of little goodies, little kind of toys that you'd kind of find in the vending machine of sorts, so that the child could still receive something. I think she also did little treats that she knew he could eat so that he could still participate in the activity. So I think the exact example, sorry, I'm kind of rambling now that I'm thinking about it, but the exact example was what happens when a child has a birthday celebration in class and they want to pass out cupcakes. The child can't eat the cupcake, and so what do? The mom wanted in the 504 that the teacher would access something in the goodie bag that she gave, whether that be one of the little toys or one of the cracker packs that he has, so that he can still participate, but he's not consuming the things that he shouldn't be eating. As for the health para, that really does depend on your school district. I will say that when you're requesting one-on-one support, that's typically something that would be put in a school order. And then sometimes they'll escalate it and put it into an IEP. But I found that once it's in the school orders, and if there isn't a need for an IEP due to educational reasons, then it just stays in the school order, and the school will talk to you about what they can provide. If you do have one-on-one nursing at home, oftentimes they will ask you to use that during the school day, but just know that sometimes isn't paid for by the nursing agency. Sometimes it gets paid for by the school, like the school pays the nurse's salary. It really depends on the school district's dynamic. Emily shared some really great points in the chat about ways to support for an IEP in 504. Alina had shared, I had a 504 request to be notified of any food-related activities as well as water. Elementary school was notorious for counting the Skittles, yep, or other similar lessons where my child wasn't able to participate. Great example, Alina, exactly. So is there an alternative we can give your child so they can still participate in the counting activity? It's just not Skittles. Maria had asked, my child has a G-tube, has a risk of aspiration, dysphagia, swallowing and feeding difficulties, lactose intolerance, all the things. He can eat by mouth, but he needs to be closely monitored. Can I ask for the OT, PT, nurse, and nutrition specialist to evaluate him for safe eating? Great question. Yes, you can ask a feeding therapist on your team. At least at Children's, I know our speech language pathologist provides swallow studies to see if it's safe to eat. So I would definitely ask your medical team who would be the best person to go through that, so that then you can share with the school, you know, we formally have this issue that like studied diagnostically. This is what's happening to my child. How can we accommodate him in the school day so that he can attend safely? Awesome.
Great questions. And again, thank you so much, Ashley. And so just a reminder, the recording of this webinar will be made available on our website. And we also have another webinar on September 24th to discuss preparing for higher education. So make sure to register for that as well. We'll also be having our September Community Connection on Friday, September 27th. It's at 6 p.m. Eastern Time. And these are just a great way to connect with others in the nutrition support community, regardless of where you are in your own journey. So please follow us on social media if you're not already, and keep an eye out for an email coming with more programming opportunities and much more. So thank you again and have a great day.